Welcome to Probation, the California or Los Angeles Probation Department's second town hall to discuss the impact of COVID-19 in its facilities. Today we're going to be focusing a little bit on our juvenile facilities, but we'll be touching a whole host of issues. And we have representatives from a number of different departments joining us today. First, let me introduce myself. My name is Adam Wolfson. I'm Departmental Public Affairs Manager for the LA Probation Department, and also want to let you know that this event's being recorded. We've received many questions in advance that we'll be asking, but if you'd like to ask a question during the event, please type it in the Q&A box and we'll do our best to get to as many as possible. We'll also try to answer your questions through the Q&A box as well. As I mentioned, we have representatives from a number of different county departments: the LA County Probation Department, Department of Health Services, Department of Mental Health, Department of Public Health, and the LA County Office of Education. All these agencies are responsible for keeping youth in probation facilities safe, healthy, and receiving the services they're entitled to. We want this to be a fruitful dialogue, and all our panelists today will do their best to answer each question in the most transparent manner possible. That said, we're not able to discuss the circumstances of any specific youth in probation custody or any pending litigation involving LA County Probation or our partner agencies joining us today. I also encourage you to check out Probation's COVID-19 information that's being posted on a daily basis at probation.lacounty.gov/coronavirus. Some other agencies are also issuing helpful information on their response to COVID, and that can be found on the respective websites. Finally, if you're having any technical difficulties or you have a problem hearing one of the speakers, please let us know in the Q&A box as well. With that, we'll begin, and we'll start off with our Interim Chief Probation Officer, Ray Leyva. Chief?
Good afternoon, everyone. Thank you for joining us during this week. It's Probation Services Week, and I welcome you all to the town hall, our second town hall, where we'll be focusing on juveniles, juvenile facilities. Having said that, we have a great team of experts on board from public health, mental health, and our education partners to share their take on what we've been doing through our facilities and across the board as we protect the youth and try to move them forward and make their lives better while they're in the care of probation. So thank you again for joining us, and I look forward to a robust conversation throughout the next hour during the town hall. Thank you, Adam.
Thank you, Chief Leyva. Next, I'd like to introduce our Chief Deputy for Adult Services, Reaver Bingham.
Good afternoon, everyone. As Adam said, my name is Reaver Bingham. I'm the Chief Deputy of Adult Services, and we really want to leave most of the time available to you to interact with us and ask questions. So I'm just going to simply say welcome, and we look forward to interacting with you. Thank you.
Great. And next, speaking on behalf of our Juvenile Services, I'd like to introduce Tom Faust.
Good afternoon. As Adam said, this is Tom Faust, representing Juvenile Services. Along also on the call is Deputy Director of Juvenile Field Services, Felicia Cotton, and also Bureau Chief Jennifer Kaufman. I do want to just bring up to date on a couple quick items, and they were related to, I think, some of the ongoing interests in terms of the population in our facilities. So I wanted to give a quick update on our youth populations. During the pandemic, we have continued to work very closely with Juvenile Court, Public Defender's Office, APD, DA, and many other of our partners to continue to try to see how we can safely reduce juvenile populations in our facilities. Just to give you a quick look in terms of these last 4 months during the COVID pandemic, as a comparison, back on March 16th, really at the beginning stages of COVID-19, the total population in our juvenile halls at that time was 536. Now, 4 months later, our hall population has dropped to 331 as of yesterday, which is a 38% reduction. in our camps. The population total was 286 back on March 16th. And again, now 4 months later, has reduced to 185 currently. Couple other things I'm pleased to say, as many of you probably know, again, over these last several months, we've had to close down and suspend in-person visitation. Chief Leyva has been looking at this very closely. We've been working very closely with Department of Public Health, our Juvenile Health Services, in terms of seeing when we might safely be able to reopen or phase in some in-person visitation. While we have done virtual visitation and a lot of things from a technology standpoint to try to mitigate the suspension of visitation, we all understand, and probation certainly realizes, the great benefits and the need for youth and families to have that in-person visitation. So one of the things moving forward is on a very kind of a phased-in basis. We are going to start and have targeted this coming weekend for 4 camps to start, again, a restricted version of in-person visitation, again, making sure that we're following all the guidelines that were given with Department of Public Health. But we're very excited to be able to try to start in a phased-in process to slowly get back to allowing in-person visitation, again, in close collaboration with the Department of Public Health to make sure we keep that very safe for the youth, for the staff, and for the families. One other thing I just wanted to hit was an exciting thing also this past Friday. We reopened the Campus Kilpatrick in Malibu and moved we had 32 youth who were at the Challenger facility and did a very successful move and transition back on Friday to the Malibu campus for Campus Kilpatrick. I have to say it was really, really nice to see the excitement, really both by staff and the youth, but the excitement in the youth when they came into those cottages and really saw the environment that's there, you know, compared to, I would say, where they were at Challenger. So it was very nice to see the transitions going well. Have to thank our partners, LACO, DMH, Health Services. They're all back on site. Again, things are settling in well, but that was a long time coming since the Woolsey fire. Many months of having to renovate, having to make repairs, and finally we're at the point again Friday where we were able to move back to that environment of Campus Kilpatrick. I would just say this continues to be a challenging time for us. Things, you know, change almost daily, weekly. You know, all of us, not just in probation, but all of us in the community have kind of experienced a setback here where it seemed like things were starting to loosen up. Things were, you know, maybe starting to open up more, and then all of a sudden we're all having to take a step back. So probation is continuing to do that also. Again, we continue to work very closely with Department of Public Health and our other health partners to ensure that as we try to look toward normalizing things and going back to more normal operations, we do it in a very planned and a very safe manner. Thank you again, and with that, we'll move it on, Adam.
Great. Thank you so much, Chief Faust. Next, we're going to hear from Brandon Nichols, who is our Chief Deputy for Compliance and Strategic Planning. Brandon?
Thank you, Adam. I'll be quick because I want to save time to get into some of the questions, but I do want to say a few things. First, I think that dialogue between us at Probation and the community, the people that are on this video stream right now, is absolutely critical. And as we get through this COVID period and start to think about the future and start to do strategic planning in the future, I personally want to commit to meeting face to face and talking about what the probation department should be doing as we grow and advance. Secondly, I want everyone to know that I'm part of the team that produces the weekly reports. Adam mentioned the link for those reports at the beginning of this video stream, but I encourage you to go to those reports, and we're now starting to publish in the reports an email address. If you out there have questions that we don't get to today, you can send those questions to the email address listed in our weekly reports, and we will try to answer them in future reports as we go along, in addition possibly to other opportunities like this. But I think it's absolutely critical that you have an avenue to get to us, and that somehow we're pushing information back out to you in response. So thank you.
Thank you, Brandon. And that email address that he's referring to is probe-news@probation.lacounty.gov. It's the same email address we posted for you to send questions in advance for this event. So please get those in if you'd like to see certain things in the weekly update, and we'll do our best to include them. Next, we're going to start hearing from our health partners. First is Dr. David O. He is the clinical director for the Juvenile Court Health Services. Dr. O.
Hi, good afternoon. As Adam said, yes, my name is David O. I'm the interim medical director for Juvenile Court Health Services. So, basically, we've been working with probation and the other partner agencies to help evaluate and identify those youths who have been exposed to COVID, who are high risk for COVID, or who actually have the COVID infection. We've already gone through a round of testing for all the youths in the facilities to determine if there were any issues of possible infection within the halls and camps. Now we're concentrating on those youths who are admitted in the halls. This way we can help to try to contain any possible infections to prevent spread within the facilities. We're also currently currently testing those youths that are going to the camps, since those will be the ones that will be within the probation facilities for an extended amount of time. So far in total, we've found there have been 38 COVID positive youths. Lately, just in this month of July, we've had 11 positive youths, which can kind of reflect what has been happening out in the community that we've seen so far. The majority of these youths are ones that are picked up during the time of admission. Most of these have also been without the typical symptoms of COVID infection. These ones without the symptoms, and even those who have had them, luckily have all been recovering well without any complications. This current workflow for the new admissions is such that where the youth are placed in a quarantine unit and tested. This unit is a regular living unit, but just has been separated from the rest of the population. So it would prevent potential infection spread until we get the test results back. Any youths also that have been exposed to a COVID positive person are placed in a quarantine area where we can test them and monitor for signs of and symptoms of a COVID infection. We've worked with probation to set up these areas to quarantine and isolate the youths, also to help prevent the spread. We've also done putting up signage and educating everyone about continued use of face coverings, maintaining physical distance as much as possible, and good hand hygiene to practice good infection prevention. So during this time, we've been fortunate enough to be able to consult with public health and DHS specialists to come up with these guidelines during this pandemic, specific for correctional facilities. And we're going to be listening to two of these consultants. An important infectious disease consultant, he's a specialist from Harbor UCLA. He's been an invaluable resource to us. And I'd like to introduce Dr. Lauren Miller, and he can tell you more about himself.
So thank you, David. My name is Lauren Miller. I work at Harbor UCLA Medical Center, where I'm the Associate Chief of Infectious Diseases. I've served as the Medical Director of Infection Prevention and Control here at Harbor UCLA for 8 years. And currently during the COVID pandemic, I was asked by LA County Department of Health Services, or DHS, to assist with infection prevention and control responses being part of the team that is helping prevent COVID infections in our hospitals, our clinics, and in the correctional facilities as well. So I've been serving as a consultant for the juvenile facilities and working with the DHS infection prevention and control team that specifically was tasked to help with prevention in all DHS facilities.
Thank you, Dr. Miller. And also representing the Department of Public Health, we have Leyva Tessima. Dr. Tessima, can you tell us a little more about yourself? And you're muted right now.
Apologize. Thank you for the opportunity to participate. So my name is Leyva Tessima. I am the COVID-19 liaison for correctional facilities within the Department of Public Health. And in my role, I work with correctional facilities, including juvenile probation, to provide guidance on COVID-19 prevention and management, and also to serve as a resource for facilitating testing within juvenile probation facilities. We work closely with juvenile court health services, as well as Department of Mental Health and probation to facilitate questions that come up around COVID-19 management, develop protocols around emerging priorities such as reopening for visitations, and as well as facilitate testing for youth.
Thank you so much. And as important as the physical health is of the youth in probation facilities, their mental health is equally important as well. The LA County Department of Mental Health has a presence in our facilities offering care to the youth. Representing them is Dr. Hanu Demirla. Dr. Demirla, if you can turn your camera on and unmute. Here you go.
Hi there. Hi, everyone. First of all, happy Probation Week to our probation partners. And but for this very important collaboration, much of it could not be done. Having said that, I think mental health does have a robust and significant presence both in our halls, camps, and Dorothy Kirby Center. Our workflow involved a bifurcated process in the past few months, where we did have a few staff teleworking, and also there was also on-site in-person presence as well to address enhanced levels of supervision, as well as any crisis situations that needed to be addressed for de-escalation purposes. During this past few months, we have learned a lot. Needless to say, we have realized the value of video conferencing, and we have set up kiosks, multiple kiosks. In total, about 39 kiosks have been set up, 16 each at each of the juvenile halls, with the Cisco WebEx video conferencing platform, and about 7 of them in the camps, as well as Dorothy Kirby Center. I must say that the video conferencing has progressed smoothly, and it is we have a new process in place, and which can continue. This is definitely an investment. If there's any silver lining that COVID-19 has left, it's probably that we have been innovative in creating new ways to serve our youth in an effective way. We also have the Juvenile Justice Transitional Outpatient Services program, DJ Talks. This is the program. This is also a collaborative effort between Probation and DMH with the camps, community camps transition services, CCTP, and we do have that also on video conferencing platform now. We're using the VC platform, which DMH uses in its outpatient sector. So we are introducing that to the JJ Talks program. So once youth leave the facilities, that they are linked to one of our psychiatrists and clinicians, so they can be followed on the outside. The immediate needs are taken care of, and then hopefully we're able to find them solidified linkages, so there's a warm handoff. I think I wish for this collaboration to continue and to get bolstered. Thank you very much for having me. Appreciate it.
Thank you, Dr. Demirla. And finally, representing the LA County Office of Education, we have their Chief Education Officer, Maricela Ramirez. Maricela?
Good afternoon, everyone, and thank you for inviting us here today. At LACO, we understand how important it is to provide live instruction to our students in the juvenile halls and camps. I want to say thank you to all of our partner agencies for your support in this work. Currently, our students are receiving live instruction virtually, and our technology department, teachers, administrators, and all of our staff have worked diligently to do this. As mentioned, we are providing live instruction to our students, and we've also been able to use the virtual platform to be able to engage with our families. We've held a couple of town halls, and we continue with our parent workshops. And again, thank you for having me here today.
Thank you very much. Now we're going to get to the questions you all sent in. First one is, what precautions are being taken within juvenile facilities to prevent the spread of COVID? Has there been any thought to conduct more activities and services outdoors? I think we'll first go to Dr. O, who can kind of talk about efforts that are being done on the medical side, and then we'll bring in Chief Faust to talk about some efforts that probation's doing. So Dr. O?
Hi. I'm sorry, could you repeat that first part of the question again?
Sure, no problem. What precautions are being taken within juvenile facilities to prevent the spread of COVID?
Yeah, so we've been doing that with the testing when they first come into the juvenile halls for admission, and then quarantine the youth until we get the test results. Basically, what we do is also continue to do the education, as I said, for the infection prevention. There are numerous ways that the youth can also mention if they have any symptoms. They can notify the probation staff to do a consult for the medical staff, and they can also contact the medical staff directly if they're out in the units. There are several other ways that we can do the notifications for the youths, but they're all reliant upon that's communication that happens between the youths and us in probation.
Great. And Mr. Faust, did you want to talk a little bit about kind of the second part of that question in terms of the thoughts to conduct more activities and services outdoors?
Yeah, just.
And if you can turn your camera on too, sir.
How's that?
Even better.
Okay. Yeah, just a couple things, and I may also ask our bureau chief, Jennifer Kaufman, may want to add on to this. But in terms of the outdoor piece, a good example is, as I mentioned, is we're pointing toward starting some restricted in-person visitation at 4 of our camps. That's all going to be done outdoors. And again, that was done in collaboration with the Department of Public Health in terms of what we can do to try to return to some of those important services such as in-person visitation. And that's something we will be implementing here on a phased-in basis, beginning with doing it outdoors, which is, provides a more safer environment overall. So that's one example where we are starting to try to do more things and look at outdoor alternatives. Also, certainly in terms of recreation, we've on an ongoing basis has continued to do that. Certainly outdoors as opposed to using gyms or other activity areas such as that. In terms of the what we do, I mean, on a daily basis, we're have all types of mitigation efforts in terms of social distancing, in terms of screening, in terms of temperature checks, all of those things that we do, again, in collaboration with health services, but on the operational side. Again, Bureau Chief Kaufman may want to add on some of that.
Sure. The only thing I think that I would add is that some of the therapists actually are doing their groups outside. We do have the gym, we do have other rooms where kids can do activities, so we try to rotate them. A lot of time is spent out in recreation. We have intramural sports. Some of the facilities actually have equipment, workout gym equipment. And so those are being sanitized regularly so that you can use them when they're outside. And we try to maintain social distancing as best as we can.
Thank you so much for that. Next question, and we're going to go to Department of Mental Health first for this one. But probably all of you can chip in here. What access to education, access to family video conference visits, access to mental health and medical treatment look like for youth who are isolated, testing positive, or exposure to a person testing positive? Are young people essentially in solitary confinement when quarantined? Our understanding is that when young people are being quarantined, there's very limited internet access, if any. How does that impact each of the issues mentioned above? So Dr. DeMerlo, why don't you talk on the mental health piece first, and then we'll go around the horn here.
Sure. Actually, there has been much evolution on the subject since COVID-19 began. And I will also request Dr. Stripe to chime in to add if I missed anything here. I think the youth are being seen, and typically if there's a crisis, our staff have access to PPE and they wear the necessary PPE to go ahead and see the youth, and our staff presence is there in the quarantine units as well, and youth taking the necessary precautions, which is mainly the personal protective equipment. And we are also performing MAZES, which is the initial evaluation at the halls, and assessments are being done, and so also our psychiatric evaluations and follow-ups. Now, it is a little bit of a challenge, I must say, especially when it comes to the isolation units and the quarantine units, but I must say that they're being assessed and followed on an as-needed on a regular basis. And Dr. Stripe, if you would like to add anything, please do.
We'll go to Maricela Ramirez next on that same question, talking about the access to education youth who are testing positive or quarantined are receiving.
So when students are quarantined or isolated, they are receiving instructional portfolios. And so they are packets. Unfortunately, our network only works in our classrooms, and we are actively looking to remedy that situation because we want to be able to ensure that our students have access anywhere in the facility to live virtual instruction.
Thank you. And Dr. O, can you let us know how COVID positive youth are being taken care of in our facilities?
Yes, the youth still have access to medical care. They're being seen by nursing and other medical personnel as needed. If a youth is in quarantine or isolation, they're seen by the nurse once or twice a day and as needed to evaluate for any symptoms, to check their monitor their vital signs. They're also being seen by the physician. If they are COVID positive, the appropriate full PPE is provided and used while they see the youth, but also anytime that the youth has any kind of request for medical services, it still is done where the health staff are still seeing the youth.
Thank you. And finally, Mr. Faust, the same question, but what does it actually look like where the youth are being housed as they are under quarantine, or if they're isolated for testing positive? You can kind of give us a little
they would be quarantined in the particular unit or cottage. For example, we've had a quarantine at a cottage at DKC as an example. So they are in the cottage, in the unit where there was a possible exposure. And again, so they remain in it's not isolation. They're in the unit that where they were living. They do continue to get, for instance, even a unit, if it's in quarantine, they're taken out for recreation, again, in small groups, and and separated, but they would go outdoors for recreation. As was mentioned earlier, they have full medical, mental health services. Instructional packets are given for their educational instruction. So the living unit, so to speak, and the activities are I would say, as normal as possible, but not set aside in some separate isolated unit, but in the normal unit that they would have been in.
Thank you. And why don't you stay on camera there, Mr. Faust, because this next question is coming to you as well, and also Dr. O. Why is it that staff and kids are not mandated to wear masks? How is this being enforced? After all, this is a California mandate and an LA County mandate. I'm also curious as to why staff, probation, medical, DMH, etc., are not being tested for COVID at the workplace. Although the kids are being tested, why are staff not being tested?
Well, I'll take part of that. From the operational side, staff are in fact mandated. Both staff and youth are required to wear masks. And it is made very clear to our management staff. Managers, in fact, have been instructed that on the staff side, that if staff are not in compliance, that staff are to be written up if they're not in compliance with mask wearing. So it is in fact mandatory within the facility to wear masks. On the other question, I may have to punt somewhat to Dr. O on that, but I would say in terms of the protocols on testing on the staff side, it is true we do not require, we don't require staff to be tested. We do, however, very closely follow the DPH, Department of Public Health, protocols as it relates to screening, temperature checks, and self-monitoring. So if there is a staff member who is in any way feeling any symptoms, or they're immediately, and constantly we keep reinforcing this, that if you feel at all like you have any symptoms, stay at home, or they're immediately sent home, and not allowed to come back until they have medical clearance. Again, in keeping with the guidelines that were given in terms of self-monitoring and quarantining at home.
Yeah, this is Leyva Tessema from Public Health. I just wanted to echo that Public Health currently does not recommend universal asymptomatic testing of individuals at work sites. Of course, if people do want to get tested, there are resources within LA County where people can get tested either through the drive-thrus or through their primary care provider. But for people that are asymptomatic, we don't necessarily recommend testing of staff. So what juvenile probation is currently doing is, in fact, in compliance with our own recommendations. So I just wanted to reiterate that.
Thank you very much. Our next question is going to go to Leyva. And essentially the question's asking, are youth getting in-person education in probation facilities? What's the plan to educate youth in probation facilities, either in person or virtually?
Thank you for that question, Adam. So as I previously had mentioned, the students are receiving a virtual live education, and that is our current model. And as we're moving forward, we are looking to expand programming and our educational offerings. And we're bringing in, CT programs and connecting and bringing CBOs. At this point, everything is virtually, but of course, we're working closely with public health to see what our next steps are as well.
Thank you. Next question we have comes from our Q&A box here, and it might be best for either Felicia Cotton or Mr. Bingham to answer this. And that question is, as I lost it navigating a bunch of things here, but that question essentially is, how do individuals who are in the community, or specifically, how are folks being referred to community organizations to receive services upon release during this COVID-19 pandemic? I know who wants to take that first.
Yeah, I'll start off on the adult side, Adam, and thank you for the question. As most other folks have said on this town hall so far, is that we're doing things virtually. COVID has slowing things down a bit, and it's caused us to be very creative in how we're referring for services. But we do have some community-based organizations that are robust enough to be able to provide services virtually, and we are doing that as best we can. That question is really relevant in that we are, as some of you may know, we are processing releases from CDCR now, and they're being released in mass. You probably heard the governor's press conference wherein 8,000 plus individuals are being released in an expedited fashion as a result of COVID. LA County, of course, gets the lion's share of those individuals. So we're working very feverishly to make sure that our DPOs are in place to receive these folks, and that where a lot of them are coming out with housing needs, some are coming out, unfortunately, needing to be quarantined, and so we are working with that. And then the other reentry services, we are referring to community-based organizations as we can. It's not the same as it was before. We're continuing to work as agencies demonstrate an ability to provide services virtually. We continue to work with them, but we are looking for every opportunity we can to connect folks as we're able. One of the prime example of that would be our Doors facility. Some of you are familiar with the collaboration we have with the Office of Diversion and Reentry and the many partners that service individuals out of that location. That's just one location, but that's an example of how we are trying to connect individuals to services.
Great. And Ms. Cotton, did you want to speak on behalf of kind of what's happening in juvenile field operations on this? And
sure.
If you turn your camera on, please, that'd be great.
Okay.
Thank you so much.
Sure. Very similar to what Mr. Bingham indicated happens on the juvenile side. We continue to make referrals. Most of those services are delivered virtually because many of our service providers have moved to a home-based service delivery model. So much of it is being done virtually, providing support to families. Our officers have also gone out and brokered some services through community providers that do not have a contract with us, but are providing services. So we've been able to continue to make those referrals and ensure the support of the families during COVID.
Thank you. And while we're on the topic of community organizations, we received a question through our Q&A about programming. And can video conferencing be used for programming for youth? I know that there's been a lot of technological efforts in probation facilities to get them up and running during this. But maybe Ms. Kaufman, if you could answer this, just in terms of the use of virtual video conferencing for programming for youth in both the halls and the camps.
Sure. Through our partnership with LACO, we're able to use their Wi-Fi, and so we're able to stream some types of programming that are after school hours. So we do that. We also do virtual family visits through a family connection room. And then our program providers, sometimes they'll drop off materials in either a DVD or a flash drive, or we're able to live stream them. And so we obviously maintain social distancing, but we'll bring the youth into the room and they're able to see the instructor provide the live program.
Great, thank you so much. Our next question came in earlier, and it reads, given that juvenile facilities are small and nearly closed population, one can assume that any contact tracing following a COVID-19 positive would conclude that nearly the entire population of the facility was exposed. Are there any efforts to, one, determine and isolate close contacts to limit potential spread of COVID, and two, address COVID-related anxieties and mental health concerns? So probably either Dr. Tessema or Dr. Miller answer that first part of the question, and then Dr. DeMurla on the mental health part of that. Dr. Tessema, you're live.
Oh, sure. So I just want to make sure I understand the question. So this is around isolation and quarantine of individuals?
Correct, that and contact tracing following a COVID positive in a juvenile facility.
Sure. So, public health has recommendations that are consistent with CDC recommendations around how to determine who to isolate and who to quarantine based on the exposure. And we work closely with juvenile court health services as well as probation to identify people that are both symptomatic who would need to be isolated, as well as close contacts who would need to be put in quarantine. And so anytime there is a symptomatic individual who is identified, this is even before they are confirmed to have COVID, they are placed in isolation, tested, and all the close contacts of that person who is suspected to have COVID is put on quarantine because they were exposed, and they are put on quarantine for 14 days. And this is consistent with public health as well as CDC recommendations. These decisions are made very promptly around isolation and quarantine because we are astutely aware that any delays in isolating and quarantine individuals can lead to spread of the disease. And so we work closely and around the clock with our colleagues at JCHS and probation to ensure that the right people are placed in isolation and quarantine respectively.
Thank you. And Dr. DeMurla, if you can turn your camera on, can you talk a little bit about the anxiety that youth who are being tested or think they might be have been exposed, kind of the work that you guys do at DMH with those youth?
Sure. I think you kind of said in your question, Adam, that the anxiety that we see mainly, it tends to appear because maybe we're child and adolescent psychiatrists, most of us, and child and adolescent therapists as well. It comes from the youth side, and I have not had that many staff come and talk to me or us about anxiety issues, but definitely youth in the halls and camps definitely express a lot of anxiety and apprehension about becoming positive or being in a facility and being exposed. And certain section of youth are kind of resilient to it, and they do wear masks. But on the other hand, there are some youth who have more anxiety than usual, I think, because of the situation. I think it's very important to validate their concerns because it's a realistic concern, and it's very important to address their fears, and also take it as a moment of education. It should be it should be treated as a moment of opportunity to educate the youth about COVID-19, about what exposure is, what it means, the incubation period, and the reasons why, as to how the mode of transmission happens, and about also things like transmissibility, which is an important thing. Not everything that we do leads to COVID-19. There are certain types of things like droplets or surfaces, or it could be aerosols. I mean, there are various means by which it spreads. So I think we need to emphasize the basics for the youth to wash their hands and watch their distance, wear their masks, and in all likelihood, chance of transmission is much lower if those things are done. I think we should treat it, validate their concerns, empathize with them, and treat it as a moment to educate. I think those would be my initial takes. Thank you.
Thank you. Our next question, kind of combining two questions here about Campus Kilpatrick. The first part will go to Mr. Faust or Jennifer Kaufman, and that is the LA model being implemented at Campus Kilpatrick? The second part that will probably go to Howard Wong next is, with the fire season approaching, how are probation facilities preparing for that? But maybe we talk first about the LA model, Mr. Faust.
Yes, and I'll let Jennifer speak on this also, but I mean, essentially, we're talking about a small group model, which is being implemented, will continue to be implemented at Kilpatrick. That's what the design of the Malibu campus is to have kind of a small group care first model, so to speak. And a lot of it is too, around more decision making, more choices. I think more real world experiences that we can bring to the youth and give to the youth in terms of making decisions. But so the short answer is, in terms of the LA model, yes, that is the model that both the facility is designed around and the operational programming around the small group model. Jennifer, you may have some other things to say about it.
The only thing that I would add is that the philosophical of having consistent staff, accountability, organizational support, and empathy is all the cornerstone of how staff treat youth. And we do have our mental health that are within the cottage as well, so there's consistent staff to deal with those issues. We also have daily circle ups throughout the day to reinforce good behaviors, all centered around positive youth development. So I just wanted to also, on the fire evacuation plans, I know that Howard will go into our deeper plans, but prior to that, we had made sure that our plan was updated. And since being back, we have done fire drills and training with all the staff.
Howard?
Good afternoon, everybody. In our last town hall, I mentioned that we have 4 EM staff that works with the department and 3 LESD retired E's that came back on the 120-day. And these folks were working the Emergency Operations Bureau out of the sheriffs, which are experts in these type of evacuation and disaster planning. So in July, they started training, wildland fire training for all the juvenile sites, starting from the East Camps to Central to Kirby, and they're actually going to be at Kilpatrick tomorrow, conducting the training, the wildland fire training. And at the end of that, there's a development of the evacuation plans. So by the end of the month, all the East Camps, Kirby, and 2 halls will be trained in wildland fire, and there will be a robust evacuation plan and training for that with downline with all the staff shortly. So that is the goal, and they will be at Kilpatrick tomorrow. That's it. Thanks.
Great, thank you for that information. Our next question here is going to go to Maricela Ramirez from LACO. And that question's regarding things used for educating youth in facilities when video might not be available. Are there other supplemental materials provided besides packets? Many solutions don't require internet access, such as tablets with preloaded content, audio recordings, video recordings, etc. Can you talk a little bit about that?
Sure. So with our, just for clarity, I just want to make sure that we use, the packets only when students are in quarantine and they don't have access, to our classrooms. And that being said, our packets are a combination of things, right? And one is that they're actually downloadable materials, from certain systems that we have on our computers. So we print them out and we provide them to students. Now, as I mentioned earlier, we are looking into expanding our network actively, and this is something that is urgent to us. But at this time, we are just providing the student portfolios, for our students. And in terms of, the audio recordings or video recordings, that's something that we are happy to look into. Thank you.
Thank you. Our next question is going to be directed towards Dr. DeMerla, and it's regarding the privacy of for youth who are using kiosks in probation facilities. Specifically, can you describe the virtual kiosks and how you ensure a young person's privacy? Also, are young people who are being quarantined able to access these kiosks? If not, how do they access mental health services? Dr. DeMerla, can you touch on that a little bit?
Oh, yeah. Can you see me and hear me okay?
Yes.
Yeah, so I must say that from the federal level itself, there has been a relaxation of several confidentiality and HIPAA laws on account of the pandemic. So, for example, many providers in the community are even using things such as Skype and FaceTime and other tools in order to communicate with their patients. And there has been a lot of relaxation in terms of texting and other modes of communication. I think that's the basic framework that has been relaxed for providers to be able to be in touch on a regular basis with their patients and clients. Having said that, we are using a more protected network here with Cisco WebEx, which is one of the approved platforms of LA County DMH. Probation is also evidently using it for court and other purposes. And we do have a workflow process that we have developed after careful consideration. And probation leadership has that workflow where there is a specific way in which the youth is brought to the kiosk. And you asked me to describe the kiosks, so let me just go into what these kiosks are. These are actually dedicated laptops with no other functions. Basically, all the other applications in the computer have been taken away essentially, and the sole purpose of these laptops is for youth to be able to communicate with their therapists and or psychiatrists. And and the bifurcated model that I referred to earlier, that actually gets boosted up by having kiosks, meaning, so initially say it's a quarantine unit and wearing PPE, the clinician initially talks to the therapist, the youth, and then gets the necessary amount of information, but then the youth would like to talk more. It needs to be an ongoing therapy. So, especially in situations where in-person, on-site activity or work is probably restricted because of the nature of the situation, then the kiosk enables the therapist to talk at length with the particular youth. And also in situations like psychiatric follow-up and other medication support services, in all those instances too, I think the kiosks help. Typically, there's the probation staff bring the youth to the kiosk, which is actually a mental health office in which this dedicated laptop is kept. The youth is actually sitting there by himself or herself, and the probation staff are not actually with the youth there. They're standing at a certain distance where they can intervene if should there be a crisis or some type of situation, because we also have to be mindful of that. So I think it's a pretty balanced way of looking at security and safety of the youth, at the same time affording privacy that the youth deserve. Thank you.
Thank you, Dr. DeMerla. This next question is going to be geared towards probation staff. And just as you talked about mental health counseling, pastoral counseling is often very important for youth. Specifically, the question is, how about the youth that are asking for their faith services like Mass or to speak to a chaplain to provide their faith needs? Mr. Faust or Jennifer, would you like to answer that?
Sure, I could take that one. So weekly we get liturgy guides from Catholic services or Protestant services that are passed out and disseminated to the youth. We're also working on a schedule for youth to have a virtual conversation with them. Right now they're done telephonically. Also, we do live streaming of different religious services throughout the week. And in the juvenile hall, since we don't have the live streaming capabilities, they are given DVDs and flash drives to show the youth that want to watch the religious services online.
Great. And another question for probation staff about the status of probation's citation diversion program. Who would like to take that one?
Adam,
Cotton.
how are you? The citation diversion program, the hearings for it is currently suspended as we are looking to implement a better process to be able to have virtual hearings. We are now trying to study and learn if those hearings can be done using a cell phone. Once we get that piece up and rolling, the hearings will be back in effect. However, we will be publishing a 1-800 number on ProbeNet for folks to call if they have questions. We are still dealing with those cases that we can via telephone. So the hearing portion of it has been suspended until we get a virtual response to that process.
Thank you so much. This next question, we're going to go about 5 more minutes. We appreciate all the questions that have come in. We're doing our best to answer them both through the Q&A feature, and we'll incorporate a lot of these questions and answers to these in our weekly updates as well. But a question we received is about probation offices, and maybe Mr. Bingham, you'd be the appropriate person. Specifically, it's really 2 parts. One is, when do we plan to reopen the area offices safely, and when will that take place? And what are the plans, rather? And also, are we looking at installing things such as plexiglass or other PPE equipment for that?
Available for rent?
Sorry about that, Mr. Bingham. I'm going to unmute you here. Hold on, please. Or if you can unmute yourself, that'd be great.
Yeah, I did, and then something happened. But thank you for that question as well. We are in the process of having discussions about reopening the area offices, and as a matter of fact, our discussions are not in isolation. The county as a whole is looking at the reopening of offices to the public. Now, we did have a soft opening plan for July 6th, but with the uptick, we're working with the CEO's office to kind of slow, and public health, to slow that process down. We want to be consistent with the health officer's guidance, and the guidance right now is to kind of slow our roll a bit. So we don't have a definitive date as to when we're going to open the offices. We are in the process of writing our plans. All of the county departments were tasked with creating a reopening plan, and that plan is to include all the recommended safety PPE, retrofitting the offices with plexiglass where appropriate, ensuring that we have hand sanitizers, masks, that we're able to social distance where appropriate, the whole 9 yards. So we're working internally with our management services bureau. Mr. Johnson and his team have already started working with the deputy directors to do walkthroughs of the various area offices, because every office is different, and what is needed is different. So they are developing the plans for each area office. And when we do open, it will probably be in phases, and those phases will be as offices have what's necessary or what's recommended by the health officer to be able to open. Then we'll do that, and we'll start phasing people in and servicing. We are eager to get the offices open, because even though we're trying to do things virtually, there was a question earlier about providing services to individuals, and just to be very frank and honest, even though we're doing everything we can to try to do that, it's just simply not the same. And we do not acknowledge that even in a post-COVID environment, we're going to probably do some things different based on lessons learned here, but we are working to try to get that done. But it will be, as the surge lifts and we get COVID better under control, then we'll start opening the offices in phases. And if I could just piggyback on this question hasn't been asked yet, but I know there's a lot of questions about how long will field DPOs continue to deploy to area offices, to custodial facilities. That's going to happen indefinitely. And I know that there are some that are, I saw a question earlier about the fairness of it. As people are observing, they may see certain people are deploying and others are not. And what you don't know as you're trying to observe the landscape, we're not able to share individual staff members' medical situation. We can't share with you who has medical restrictions and unable to provide services in a custodial institution. You may also not know some of the other things, the priorities that come up, such as we had to pull people out of deployment to service the courts. As the courts open, our deputy probation officers that service the courts had to be pulled from the deployment schedule to service the courts. I spoke earlier about the expedited releases from the state prison. Well, the AB 109 folks had to be pulled to be able to service those individuals. So the pool of individuals being deployed is shrinking a bit, and it may seem like others are having to take even a heavier load, and that's true. And we do appreciate you for doing that. But as the situations change, and they're very fluid, as they change, then the deployment situation has to change. So to some, it may appear unfair because some are going and others are not. We're taking all that into consideration. And what I just explained are those scenarios that you may not be aware of, but we're trying to be as fair and equitable in this process as possible. Thank you.
Thank you. Our next question also came through our Q&A, and we have time for 2 more questions. But this question is regarding pregnant girls who are in probation's care in LA County. Specifically, I understand that pregnant girls have been sent home because of COVID risks before completing their time. My questions are, number 1, what has been the protocol for monitoring the girls and ensuring safe and healthy pre and postnatal care, mental health support, etc.? And number 2, how soon after delivery are they expected to return to facilities? And finally, number 3, what kind of measures are taken to ensure the health and safety of newborns? I don't know, either Ms. Cotton or Mr. Faust, if you'd like to answer that.
Let me take a portion of it, and certainly our JCHS partners can chime in. We currently have a process where we look at all medically fragile youth at the point of when they come in during intake. Our pregnant youth, pre and post COVID, we really try to find another setting for those youth to receive rehabilitative services where appropriate. And when appropriate, we seek court intervention to get those youth released to appropriate settings, such as our group homes, such as resource families, so that they can get the care and the pre and postnatal resources that they're going to need. So that is a process that we have in place between DSB, detention services, as well as field. So Dr. O's team notifies us when we have a youth. Many of them do not know that they're pregnant at the time of intake. A lot of them learn that they're pregnant upon being admitted to juvenile hall. And we take precautions with all medically fragile youth to make sure that we expedite decisions that need to be made during the court process, such as returning them back to court, such as seeking, again, placements that specialize in resources for youth that are pregnant or parenting. again, and they receive both the pre and the postnatal. JCHS, they are great partners along with a lot of our other community-based partners with ensuring that we wrap those pre and postnatal services around those young people while awaiting for release from juvenile hall or camp and or while they're in the community. We continue that follow-up.
Dr. O, did you want to talk at all about your care and what JCHS does with pregnant youth?
Sure. As Ms. Cotton said, we do communicate with them regarding pregnant youth. If there is a youth that is pregnant, we will counsel them regarding options for them. We will refer them to LACUSC for the prenatal care. We also do have a program where we refer to public health for home health nursing too, to help give support for the pregnant youth, and also for any support they have for their family members too. We also refer to mental health pre and postnatal too, for any kind of mental health support that needs to be done, or any evaluations for stressors or for postpartum depression, things like that. So there's a lot of people that we work with to make sure that the best care is provided for the pregnant youth.
Thank you so much. And we're going to do two quick ones. First is, what are the repercussions for youth who refuse to wear a mask in a probation facility? Mr. Faust, did you want to take that? Or Ms. Kaufman?
Yeah, Ms. Kaufman can speak to that, but I would say, again, our staff, the probation staff, constantly work very closely with counseling the youth about the importance of wearing a mask. Dr. O and his team with JCHS also does a lot of education in terms of educating youth on the importance of, various mitigation efforts and the wearing of masks. So we have a lot of signage throughout the housing units and other areas in terms of keeping it at the forefront to remind youth and others, staff also, in terms of wearing the mask and that importance. So I would just say that it is constantly and on an ongoing basis reiterated to youth about the importance of wearing masks, not only for their own health and safety, but for those others within their unit. So it's really mainly through an educational process and making sure that they understand the importance behind wearing a mask. I don't know if Ms. Kaufman wants to add anything to that.
Yeah, I would just add that the education is critical. We have our Department of Health Services and our Juvenile Court Health Services that provide regular education to us. We have videos that we've shown the youth that are accompanied by a nurse. So if the youth have any questions, we constantly reinforce. We also try to incentivize them to continue to wear their mask. And I think now, in light of reopening visiting and them having the opportunity to see their families, they're more encouraged to ensure the safety of their families coming in. So they understand that all those things are predicated on, not having an outbreak. And so they're really encouraged by that. And again, the education and constant reminders. I would just also add that we do have daily inspections that occur. The managers and the supervisors walk, they do those inspections. They let us know if that's not happening. We've encouraged the staff to become champions and conduct town halls to remind other staff that they may see that are violating not wearing a mask, that they're doing that. And we have regular weekly interagency meetings with our partners. And at those opportunities as well, if there's any issues that need to be addressed in that regard, we make sure that's handled.
Thank you. And our last question today, and we'll go to each of our partners. I guess one silver lining about this whole pandemic is the embracing of technology across the board, but especially by LA County, and seeing everything that it is capable of assisting with, especially in probation facilities. So the question is, and like I said, this is for everybody, will the technological tools that have been in use during the pandemic continue to be used when things return back to normal? First, we can go to Maricela Ramirez from LACO.
Sure, I do think that the technology offers us opportunities that we may not have had before, and allows us for flexibilities that we didn't have before. There are so many opportunities that are available when one utilizes technology that it really is shifting the way we think as an educational system. And our intent, of course, is to continue to use technology and, of course, to continue to provide the best education that we can to our students.
Thank you. Dr. Demurla, do you want to speak on behalf of Department of Mental Health here on how you can see the use of technology working once the pandemic is over?
Yes, thank you for that question, Adam. For many years, actually, we have tried to introduce telemental health, telepsychiatry, telehealth, any term as relevant here. But finally, it saw the light of the day once the pandemic hit. So there have been attempts that have been made to introduce this. And it's not, of course, hitherto the technology was not as simple as it is now, because everything is downloadable and you just use the apps to go forward. Of course, not in any way undermining the efforts that our great IT departments put in here. Having said that, I think this infrastructure is here to stay. This is a wave of the future. I don't see it as being a tentative, temporary setup. I think we should continue to use them and find a manner by which we can integrate it with the on-site in-person services, so we can have an enhanced level of care in the service to the youth. Thank you.
Thank you. And Dr. Rowe.
Hi, yes. I think that, as has been said before, it's offered more opportunities, different ways of providing healthcare in our situation. One of the things is using telemedicine to be able to help address any needs if there is a absence of a provider there. For the most part, our medical services are at the camps 24 hours a day, or at the halls 24 hours a day, but the camps, they're 16 hours a day. So sometimes there is not a nurse there. So probation staff could use the telemedicine to be able to contact someone at the halls for any kind of medical advice for a youth that may have certain questions. In addition, there could be a time where a physician is not available at the camp, and so that even a nurse could consult with a doctor at a hall for medical advice for a consultation. So this provided the opportunity to be able to expand medical services and provide it more timely without having to transport the youth around. So that's one example that this could be useful in the future.
Thank you. And finally, Mr. Faust.
Well, yes, I just would agree with everything that's been said, and our partners, LACO Mental Health, Juvenile Medical Services, have all been great to work with in terms of moving forward with a lot of this technology. Not to replace services, but to supplement. I think that's one. If there's any one positive thing that can come out of COVID, it probably is in the technology area, in terms of. And not only the areas that were mentioned, but also in things like legal representation, court proceedings, remote virtual court hearings, all of those things that we're using that we could continue to use, post-COVID. And even on the administrative side, I mean, we've all found that, maybe there's meetings that we can have virtually and town hall meetings like this that we don't always have to physically get together, that weren't really options that we were looking at before. It's given us a much more of an opportunity, again, outreach into the community through these virtual town halls, such as what we're having today. Telework options across the county, where because of COVID, not just in probation but countywide, so many employees have had to telework, and the county will be moving forward and continuing to look at where can we make good use of telework and certain options. So I think all of those are areas that from the technological side will definitely continue post-COVID that will be a benefit across the board.
Thank you. And thank you to everyone who participated today in this very informative town hall, and everyone who, for participating, especially the community who dialed in. We had upwards of about 450 people joined at our peak there. And the department really values your input and participation. We received many, many more questions during the event in the Q&A box that we will be doing our best to address in future updates. And if you have other questions for our weekly updates, please email probe-news@probation.lacounty.gov. For those unable to view this town hall live, it will be posted on Probation's website at probation.lacounty.gov. And a reminder to visit our department's website at probation.lacounty.gov/coronavirus for the latest info on the impact of COVID-19 on the department. Finally, please follow the department at Twitter, Facebook, and Instagram at LAC Probation. Thank you for joining us today and have a happy Probation Services Week. Thank you.
Thank you.